Infections are very common with patients receiving bispecific antibody therapy. As many as 50% of patients, 50 to 60% of patients will experience an infection while on bispecific antibody therapy. Not much is known or has been published about CMV and CMV reactivation for patients receiving bispecific antibodies. So we looked at, over the last 2 years at our institution, all of the patients who were CMV seropositive and being treated with any commercial bispecific antibody therapy. We included both BCMA-directed therapies as well as GPRC5D-directed therapies. Overall, we looked at CMV detection in our in-house assay and CMV reactivation, which we defined as more than 34.5 million copies. We found that CMV detection was high, as well as CMV reactivation was high. As much as 49% of patients had detectable CMV and 39% of patients had what we defined as CMV reactivation. Overall, only 2 patients needed to start treatment for CMV reactivation. So while detectable CMV and CMV reactivation appears to be high, not that many patients will ultimately need treatment. We're undergoing further investigation into any predictive factors that may, predict CMV reactivation, and importantly, CMV treatment. As so far, none of the baseline characteristics, including lymphopenia, neutropenia, anemia, thrombocytopenia, were associated with increased CMV reactivation. We also looked at CD4 counts, CD8 counts, which also do not seem to impact reactivation, though these numbers were small, so hesitant to make any major conclusions.